Hello everyone, we are the group 2. Our group is the cardiovascular system. The theme of this time is a case study of patient with coronary atherosclerotic heart disease. The two types of patient care management selected by our group in the case study are tranquil nursing and leadership role of nurses in care management. The members of the group are Aurora, Moon, Daisy, Bill, and me, Steady. Okay, let's start the case study.
Hello, I'm Aurora. This is the case of our group. The 57 years old male patient walked 1,000 meters quickly after bearing a weight of about 70 kg 2 years ago. He felt sudden pain in the precordial area with the chest tightness and shortness of breath. Over the next 2 years, the number of episodes went from 1 hour to 3 months to 1 hour to 3 weeks, and the symptoms got worse. 2 days ago, he walked 300 meters with a load of about 50 kg. The patient became ill again and was taken to hospital by someone else. After a series of examinations, the patient was found to have coronary atherosclerotic heart disease. As the cardiovascular nurse receiving the patient, how will you address the management of the patient's care after admission? Disease definition: coronary atherosclerotic heart disease is abbreviated as coronary heart disease, which is an ischemic heart disease. Coronary artery is an artery that provides blood to the heart. When coronary artery atherosclerosis causes stenosis or occlusion of the lumen, it leads to myocardial ischemia, hypoxia or necrosis, and chest pain, chest tenderness, and other discomforts. This type of heart disease is coronary heart disease. Epidemiology: coronary heart disease mostly occurs in adults over the age of 40. The onset of coronary heart disease occurs earlier in men than in women, and it has been younger in recent years. Type of disease: according to different disease characteristics and treatment principles, coronary heart disease is mainly divided into two categories: chronic coronary artery, including stable angina, ischemic cardiomyopathy, and acute coronary heart disease. Acute coronary syndrome includes unstable angina, non-set segment evolution, myocardial infarction, and set segment evolution, myocardial infarction. Transcultural nursing means being sensitive to cultural difference as nurses focus on individual patients, their needs, and their preferences. Show your patients your respect for their culture by asking them about it, their beliefs, and related health care practices with the increasing global ethnic population and coronary heart disease. Cross-cultural care is particularly important in the treatment of coronary heart disease. Therefore, it's important to understand how to improve coronary heart disease care for a constantly changing population. The core of this emerging consciousness is to eliminate racial and ethnic health difference. In a diversified hospital, care must be free of prejudice and stereotypes, appropriate language, and culturally competent according to the clinical needs, preferences, and beliefs of patients with coronary heart disease. The development of personalized cross-cultural care will help them recover. Nursing management is a process to improve people's health and to systematically utilize the potential of nurses and related other personnel or equipment, environment, and social activities. Nurses play a leading role in the care management of coronary atherosclerotic heart disease. Nurses are ideal health care professionals to direct the CVD risk reduction team and to deliver multifactorial risk reduction in hospital settings. Outpatient clinics and community-based facilities. Nurses can formulate personalized nursing management plans based on the guidelines for the prevention and care of atherosclerotic management plans for inpatients and play a leading role in the nursing process. Finally, these plans can show that compared with conventional nursing care, accepting nurses the morbidity and mortality of patients under guided case management was significantly reduced. Nurses' nursing case management can improve the risk factors lifestyle of cardiovascular disease. It can not only reduce death and disability caused by CVD, but also improve the quality of CVD medical care.
Hello, I'm Moon. I'm going to talk about the causes of trigger of coronary heart disease. At our knowledge of coronary heart disease, in the family history of immediate relatives before middle has a history of coronary heart disease, or parent coronary heart disease, the prevalence of children suffering from coronary heart disease is relatively high and have a family history is one of the causes of coronary heart disease risk factors. Common including factors including hypertension, hyperglycemia, dyslipidemia, obesity, lifestyle including smoking, drinking, high fat diet, lack of physiological activity. The causes of coronary heart disease mainly including the following except in poor diet, if often eat some high-calorie food or animal fat, so the possibility of coronary heart disease is relatively large. Of course, it usually eat more. The possibility of coronary heart disease will be more, so should coronary the diet. Excessive drinking. Long-term heavy drinking will seriously impair liver function, lead to lipid metabolism disorder, and aggravate coronary atherosclerosis. It can also cause hypertension, cardiomyopathy, and arrhythmias. Smoking. Smoking is an important risk factor for coronary heart disease and the most avoidable causes. This is an obvious dose-response relationship between coronary heart disease and smoking. High blood pressure. High blood pressure brings a lot of harm, and coronary heart disease is one of the harm, because high blood pressure will lead to atherosclerosis. The problem will lead to emergence of coronary heart disease. Endocrine disorders. If endocrine disorders, then the risk of coronary heart disease. In addition, if it is a patient with diabetes, the incidence of coronary heart disease will be relatively large. Genetic. Coronary heart disease itself has certain genetic factors If the family has a history of genetic disease, then we should do a good job of prevention. H. Some studies have found that the prone population of coronary heart disease of middle aged after the age of 50, the incidence of coronary heart disease and myocardial infarction more. Occupational factors. People who usually work with their brains suffer from coronary heart disease more often than those who work with their hands. If they are engaged in some more intense work, the incidence of coronary heart disease will be greater and more.
I'm Daisy. I'm talking about the symptoms and the symptoms of the case. Symptoms: early stage. Pain in the precordial area with chest tightness, shortness of breath. Pain radiating to the left shoulder to elbow. Symptom relief after rest. Pain worsens after the patient feels tired. The time is prolonged. The pain worsens. The frequency is 2 to 3 times per week attacks. Recently, the patient suffered severe pain in the precordial area after carrying a weight. After sublingual administration of nitroglycerin, the symptoms were relieved. Vital signs assessment: increased blood pressure, increased respiratory rate, and increased pulse frequency. Topical symptoms: chest pain, chest pressure, shortness of breath.
I'm Bill. Now let me introduce the first part. Acute phase of treatment. The attack shows the emergently rest. Severe attacks, including natural caution. Under the talk, the patient was examined and evaluated in the emergency room and immediately resumed reperfusion therapy. A male patient in the case should be intubated and hospitalized as soon as possible and thermobolized. All interventions therapy should be started as soon as possible so as to reduce the mortality rate, reduce complications, and improve the prognosis of patients. General treatment. The case of the more patient to bed rest, keep quiet, reduce obesity, reduce odor stimulation, relieve anxiety. The doctor to see the patient to give patient anti-anxiety sedative drugs. Closely monitor blood pressure, heart rate, respiration, cardiac function, oxygen saturation, and other changes. Give continuous oxygen, quit smoking, control blood pressure, immobilize plant-based foods, and eat less saturated fat, cholesterol, and fat. Medication treatment is the basis of disease control in patients with coronary atherosclerotic heart disease. Adhere to long-term drug therapy. Control its chronic symptoms. Reduce the occurrence of myocardial infection and this strictly control risk factors and carry out planned and appropriate exercise. Antiplatelet therapy. Many antiplatelet conjugates the drug for aspire P2Y12 receptor antagonist. The drug are cladogoro, tracgrero, beta receptor antagonist, metal pressure, base parallel. Patients with symptoms that cannot be controlled after treatment with calcium, corner blasters, nitrates, and beta receptor antagonists. Surgical treatment, coronary revascularization, including percutaneous coronary interventions and coronary bypass grafting. Transcultural nursing. Nurses in the treatment of coronary atherosclerotic heart disease patients with the use of the leadership role in the nursing management to improve the comprehensive quality of nursing quality, improve the satisfaction of patients with nursing work, implement of the concept of service nursing. Nurse case patient by collecting details nursing plan on the basis of the condition of the patient with solid nursing knowledge, skilled operation, psychology, good spirit, enthusiasm, service attitude, and use concise, easy to understand language, answer patient accompany many inquiries. The case in patients with coronary atherosclerotic heart disease patient to carry out targeted treatment. The treatment of patients after basis goals. Nurses play a leader role in nursing management. During treatment, nurses enhance communication with patients' family members, doctors, and nursing staff to ensure the seamless completion of nursing work and stressing nursing management. For the sake of patients with coronary atherosclerotic heart disease, nurses play attention to give patients human care. The reassure patients with high quality of service quality, noble professional to satisfy the community to uh, achieve the life value of the leadership role of nurses in nursing management. Nurses give full plan to their subjective, interactive, establish a good nursing patient relationship, improve the role of nurses in nursing management leadership. Leadership role of nurses in care management. Cross-cultural nursing in the treatment of coronary heart disease patients with the outpatient of nurses patients communication with the patient's cultural background. Caregivers should must and understand the cultural background, language, lifestyle, eat habits, customers, moral beliefs, values and attitudes towards health and disease of patients and their familiars in the treatment of patients with coronary atherosclerosis. The nursing staff is familiar with the case of the more patient language expression, effective communication with the patient to provide patients with multi-level multi-system around effective care so that they are in a good physiological state, happy to receive treatment and care, completing the acute health treatment, drug treatment, and surgical treatment of coronary atherosclerosis with the patient oil personality characteristics. Individualized treatment measures are formulated, flexible, and appropriate nursing services are provided, and patient private care and care consistent with their actual needs and culture. Cross-cultural nursing is used to help the male patients with coronary atherosclerosis in the case to restore health, maintain health, and promote rehabilitation, which plays a positive role in promoting.
I'm steady. Let me introduce the prognosis part below. Prognosis of disease. The main determinant of the prognosis of patients with coronary heart disease are the extent of myocardial blood supply and cardiac function involved in coronary artery disease. Most patients with cerebral anemia survive for many years, but are at risk of acute myocardial infarction or sudden death. Patients with vascular arrhythmia or conduction blood have a poor prognosis. Patients with diabetes have a significantly worse prognosis than those without diabetes. Curable, because the cause of coronary heart disease cannot be eradicated, it cannot be early cured, and it may grow and worsen. Drug therapy is mainly used to delay the progression of the disease and reduce the losses of angina pulmonaris and myocardial infarction. Certainly, in the early stage of the disease, the impact of coronary heart disease on the patient is very limited and only restricts strenuous physical activity. However, as the disease progresses, patients may die due to myocardial infarction or heart failure or malignant arrhythmia caused by coronary heart disease. Complications in patients with coronary heart disease are caused by impaired heart function and affected systemic blood supply. Heart failure induced to reduced blood flow. Certain areas of the heart block oxygen and nutrients for a long time, or the heart is damaged during a heart attack. The heart may become very weak and cannot pump enough blood to meet the body's needs. This condition is called heart failure. Arrhythmia, insufficient blood supply to the heart or damaging the heart tissue can interfere with the electrical activity of the heart, leading to arrhythmia. Cerebral insufficiency, impaired heart function affected the pumping function, leading to insufficient blood supply to the brain. Patients with chronic coronary artery disease may have long-term insufficient blood supply to the brain, which can lead to memory loss or insomnia. Similarity and difference in counter nursing. Common as basic. The purpose of care is to control and relieve the symptoms of angina pectoris and treat coronary atherosclerotic heart disease. Difference. Different nationality cars or cities. Degree of language communication barriers. The effect of nurses in nursing patients with coronary atherosclerotic heart disease is defined, which not only effectively improve the quality of care and satisfaction of patients and improve the prognosis of patients, but also improve the communication skills and knowledge of nurses and patients. Patients with coronary atherosclerotic heart disease provide stronger protection. The above is our group case study on coronary atherosclerotic heart disease. Please see the PowerPoint for details. Thank you for watching. Goodbye.